Hello, everyone. Thank you for joining us today at our virtual reality Naloxone training webinar. We are thrilled to partner with CADCA and Walmart to present this unique experience. CADCA launched this simulation in February of 2020 at their National Leadership Forum. Since then, they have held more than 25 virtual screening events and engaged thousands of participants. We look forward to seeing this initiative reach countless more communities. Today, we will hear from a wonderful group of speakers here in Minnesota who are working every day to save lives. Then, we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Our goal is to learn how to use this technology to help community leaders like you save lives and create a norm that every life is worth saving. Now, I am pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined our CADCA team in 2021 and has been working ever since to help further their mission of building and maintaining safe and healthy drug-free communities. We are thrilled to have him with us here today. Valentino?
Hello, everyone. I'm thrilled to be here. First, I want to extend my gratitude to Walmart for their commitment to saving lives through this innovative training. For some of you, this will be your first time using a VR headset. If so, I encourage you to embrace the experience and the training that comes with it. And yes, your head will be moving around. I'd also like to thank our friends and supporters at the Minnesota Prevention Alliance. It's an honor to be on with such remarkable leaders from the great state of Minnesota. CADCA has a footprint in over 30 countries and more than 7,000 coalitions across the United States. We work with community residents and leaders to develop coalitions and reduce substance misuse by adapting CADCA's model for community change. CADCA knows that prevention is the most cost-effective and ways to reduce substance use and misuse. The emphasis on prevention is more crucial than ever before. The CDC reported that there were over 107,000 fatal drug overdoses in the United States in 2023. So let's put this in perspective. This number would fill the Vikings US Bank Stadium more than 1.5 times. This is why leaders and community stakeholders like yourselves are crucial. You are really the true heroes in driving positive change. Our partners at the Drug Enforcement Administration continue their One Pill Can Kill campaign, which has raised awareness about fentanyl-laced pills that are killing so many fellow Americans. In 2023, DEA seized more than 80 million fentanyl-laced fake pills and nearly 12,000 pounds of fentanyl powder. The 2023 seizures are equivalent to more than 381 million lethal doses of fentanyl. Their message could not be clearer. The only safe medication are the ones prescribed by a trusted medical professional and dispensed by a licensed pharmacist. As DEA Administrator Ann Milgram shared at CADCA's 2023 National Leadership Forum, this is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine, also known as tranq, as a key emerging threat and has been identified in all 50 states. It interacts with opioids in a devastating way that leads to overdoses. In a report to the White House, the Office of National Drug Control Policy stated that community-based programs will be among the first to interface with individuals vulnerable to fentanyl contaminated with xylazine. In the current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. This gathering today and the Walmart-sponsored innovative training is a huge step forward. Keep up the good work. I look forward to seeing you soon.
Thank you for joining us today, Valentino, and for all of your leadership across CADCA in this work. Turning to our wonderful group of speakers from Minnesota, we're happy to introduce you to Minnesota Representative Dave Baker. Dave Baker is a businessman, community leader, husband, and father. He owns a number of businesses in the Kansas County area and has led a number of community initiatives including the iCardinal campaign, which raised over $400,000 for the Wilmer Area Community Foundation to put iPads in classrooms, and more recently, the Wilmer Destination Playground, a fully accessible playground for kids of all abilities. Representative Baker was first elected to the legislature in 2014, now serving his fourth term. He has established himself as an effective legislator with a record of delivering results for Candioi County. Representative Baker has also been an outspoken leader on the issue of opioid misuse, chief authoring major reforms to Minnesota's prescription monitoring program, label requirements for opioid prescriptions, and more. He is committed to continuing the fight for legislation that will reduce addiction and prevent opioid overdoses in Minnesota. Representative Baker is currently serving as the minority leader and has engaged with the National Conference of State Legislatures Opioid Policy Fellowship since his selection as a fellow in 2019. Representative Baker, we're looking forward to hearing from you.
Thank you for allowing me to be here today and to speak about something that's really near and dear to my heart. We lost a beautiful boy to the disease of addiction back in 2011 when my wife and I really didn't understand kind of what this was all about. Didn't understand what a back injury did, a pill related to making his pain go away, and what it ultimately got him to with his accidental overdose a few years later. So as a state representative, I have been working on understanding this better, understanding how we got where we got to, and what is it going to do to take us to help other people who don't know what's even in front of them, like what we did back in those days. As a state legislator in Minnesota, I can tell you that we've done some pretty amazing things. We were very on the front edge of getting pharmaceutical companies to our table with getting some licensing reform in Minnesota done, where pharmaceuticals and distributors started paying a lot more money to help us create a special fund that we could do some very unique things with, granting dollars away from the legislature, creating a separate opioid council, an addiction council that was very carefully designed and made up. And since 2019, we've been doing a lot of work here to help communities with prevention, education, treatment services, and all of those things that we sometimes can't keep track of because it's so broad of all the work that needs to be done. So in Minnesota, we have just recently announced a new dashboard of up to $74 million has actually been awarded throughout the last 4 years around the state of Minnesota, and it's working amazingly well in tribal communities, in urban areas, and we are finding that every area, every district is a little bit different, and their needs are a little bit unique. And so, you know, the work almost seems like it never ends. And I want to thank you all for watching this video and for watching others trying to do what we're doing here to, again, help others in this recovery world, from our driving more workforce people to getting into the field of drug and alcohol counseling, to peer recovery specialists, to doctors who understand prescribing and addiction medicine and pain specialists. We've learned a lot about just this whole thing over the last, obviously, few decades with the explosion of what we've learned with the opioid crisis. Again, my appreciation to you is more than I can actually kind of say and have you understand it, because it takes so much work. I get exhausted thinking of the work that we've done already, and yet there's so much more to do with our people. The team I work with in Minnesota here, the ORAC Council, the Opioid Epidemic Advisory Council, which I've been a part of since we began this journey with the bill passing of House File 400 in 2018. It was a first in the country. It's one that I'm again, very proud of the results that we're getting to. What has happened a few years after that bill passed was the settlements starting to come to the states, and the agreements that we've had with our different counties, our other local public health departments, has been very complex to work with. Minnesota is receiving a large amount of money over the next 15, 16, 17 years. The role of the ORAC Council, the advisory council that I again sit on, is one of the main roles is to make sure how are we coordinating all of the state efforts, even though many of these dollars from settlement dollars are going towards the counties. Our role, I think, in policy making, and if you sit on an advisory council in your local community, wherever this is at, if you've got the ability to help direct dollars and grants and policy to advise people, I just urge you, I plead with you to communicate with other groups so that you know what's working and what's not. So you're not duplicating your services. You're not stepping on each other's toes. If one is doing naloxone and harm reduction, others should maybe be focusing in on how do we get more people in the workforce. I'm just encouraging a lot of these counties and folks that want to do good to make sure they're not afraid to ask for help. Don't just spend money on just naloxone if that's what you think you need to do. There's a lot more to it than the very end of the line with somebody needing an emergency dosage of naloxone. There's a whole bunch upstream that we need to work on. So talk to your neighboring counties, talk to your states, talk to your local health professionals, and let's just make sure that we're all communicating with each other if we're involved in that. So again, the work that CATCA does is amazing. Our national work has got to be in unison. And our communities are needing us to communicate and do our very best to tell you all what is needed and what is coming and what are the trends and what is the next thing to look out for. Because what the pharmaceutical companies did to hijack pills that are very strong opioids and heroin basically and pills to help with pain now has been hijacked by the drug dealers. And I believe that the healthcare systems have done an amazing job in the last several years to get their arms around prescribing. It's going in the right direction. But now illicit drug dealers and the bad people have taken that over, and pills now seem to be the easiest, cheapest thing to get out there. And that's where we've got to keep focusing on too, is that side of public safety and all that comes with that. But in the meantime, thank you for what you do in your own communities. Thank you for always trying to look for the next thing to help the next family, like we had to experience with our loss of our son, Dan. Our lives are never the same, and my journey now and my mission is to try to make sure that I tell my story to help others and to challenge others to do the same thing. So again, I want to just thank CATCA, the whole group that's doing everything we can to save people, to help people in recovery, to keep them alive so that there's a beautiful life ahead of them in recovery that they know is not that far away if we provide them those tools. So again, I want to thank you all for listening to me for a few minutes. Happy to follow up with anyone who has anything further. But again, just thank you for what you do in the communities, and we all need to work hard to make sure we can actually make a difference in this world of the disease of addiction. So thanks again. Have a great day.
Thank you, Representative Baker, for being a dedicated public servant to Minnesotans. Your leadership in the Opioid Epidemic Response Advisory Council and your promotion of the prevention and recovery workforce is so important for ensuring opioid services funding will reach where it needs to. Your work is irreplaceable, and we appreciate you. Our next speaker, Dr. Heather Bell, has been a key player in fostering opioid treatment services locally, and through her teaching, podcasts, and presentations, has raised awareness on addiction and recovery for countless people. Dr. Heather Bell began her career as a family physician and received her board certification in addiction medicine in 2020. In 2015, she began an opioid stewardship program that focused on appropriate opioid prescribing and medications for opioid use disorder treatment. This led to a how-to manual and mentorship for other providers and clinics throughout the state. Dr. Bell is an adjunct professor for the University of Minnesota Medical School and the Augsburg Physician Assistant Program, and she has presented at many conferences around the country. Dr. Bell's work has most notably led her to receive the American Hospital Association NOVA Award, the 2020 Minnesota Medical Association President's Award, the University of Minnesota Medical School's Early Career Alumni Award, and the Minnesota Academy for Family Physicians, Family Physician of the Year honor. She has practiced as a rural full-spectrum family physician, as a medical director and provider in correctional healthcare, as an outpatient addiction physician, and currently is a staff physician at Hazleton Betty Ford, and additionally is faculty for the University of California, Irvine in the Train the Trainer program. She co-hosts a podcast, Addictions to Recovery, which focuses on the intersection of the medical and recovery communities, highlighting and educating on addiction and recovery-related topics, testimonials from individuals in recovery, and programs and services for those in active addiction and/or recovery, family and support systems, and the general population. Dr. Bell, please take it away.
Hi, everybody. I am Dr. Heather Bell. I am a family and an addiction physician. I have been doing this work now for almost 10 years. I started out in a rural family medicine practice where the biggest issue and how I got into this program was really just with opioid stewardship and opioid prescribing. As a very new physician, I wasn't trained in prescribing a lot of opioids, and so it just became something to really look at. And our community got a grant at that point to really take a look at opioid stewardship and prescribing. I think this is where people can be very successful, is when you really form these partnerships. This grant started through the hospital and the community all together. So we had stakeholders from our schools to our law enforcement, to social services, public health, pretty much anywhere in the community where a community member who might be on a chronic opioid or who might have a substance use disorder would come in contact. From that small group that filled a very large room, we gradually built out more partnerships across the state, and just different partnerships with entities such as the Medical Association and different state and federal representatives and senators, where we could then really start to have these conversations to start making changes. The biggest thing I think we learned early on was that education is the key. In order to kind of make any changes and to really push any kind of, I don't want to say agenda, but thing you're passionate about, especially when it comes to saving lives, it's important to educate people on why you're doing this. We had a lot of patient stories, obviously, many of them that were very sad. You can bring patients in that came with us that would talk about their stories, and just did a lot of education. This ended up being very successful in what we were able to do in our very small town, that we were then awarded a grant to try to replicate the work we had done in this rural Minnesota community throughout Minnesota, where we had 12 additional rural primary care clinics that were basically replicating a program we had developed in our community, where we focused on opioid stewardship, appropriate opioid prescribing. So those who still needed their prescriptions could still have them, but we were looking at other modalities or medications that could be used. And then a big chunk of it was treating patients with opioid use disorder in a rural primary care clinic where there's access. There aren't many addiction doctors in the state of Minnesota, especially back in 2016. And so for people to have access to care for their use disorder in their local community became very, very important. This also led to a grant where we did a lot of teaching. That was a program called Project Echo, where we would go on and educate other providers throughout not only Minnesota, but also across the country on how to care for patients with opioid use disorder, and then other substance use disorders as well. So this reach ended up going from a small rural primary care clinic in central Minnesota to throughout the state and then nationally as well. At this point, having worked in other sectors now besides just primary care, I've worked in correctional settings as well as inpatient, residential treatment facilities. There's still some things that I think need to be changed and or continue to grow upon. One would still be continuing to increase access for patients. We are clearly not near the end of this overdose epidemic. I'm calling it overdose because our opioid numbers actually went down a hair in 2023, but our stimulant overdose deaths, such as methamphetamines and cocaine, actually went up in 2023. So we are still at a net positive of overdose deaths. And so access to care for all patients with any kind of a substance use disorder is key. And a lot of this comes down to destigmatizing and educating. One can't cut back their discrimination, even if it's implicit, where they don't realize they're doing it biased until they're educated on this. Patients don't necessarily want to access healthcare when they feel that they're going to be judged or they have been judged in the past and it's not felt as a safe place. Some of what I also do in my work, besides trying to do education and trying to do advocacy work, and then caring for patients, is in trying to reach patients in a little different way, or reach regular people in a different way to help educate, is with a podcast that I have called Addiction to Recovery, and that's the number 2. It's hosted by myself. Again, I'm a family and addiction physician. And then my co-host is a person in long-term recovery from drug and alcohol use. And so you get very opposite in a way perspectives, but you get both sides. You get the medical and all the scientific-y stuff that I get to bring. And then you get Josh's perspective of having lived this and having done this. And so you get both perspectives on the situation. So we really try to make it that any topic we might bring up, it can be understandable and relatable to anybody, all while trying to just get that education and that message across to people. I think the biggest thing that I would say to people who are wanting to help or who are wanting to learn more is be a safe place. And what that looks like is curiosity. So asking questions of people. If you don't understand, how did you get into this situation? It's okay to just ask. Tell me your story. What happened to you? Accept people where they're at. They're much more likely to then feel comfortable and safe with you. So then you can help educate them on whatever you're trying to help them understand. Using drugs is bad. We know that. But that doesn't get to the root of the issue here. It's being open to hearing the patient's perspective or the loved one's perspective. So then you can try to meet them where they're at to then get to that place where you and they might think they need to be. And it's kind of just joining together in that regard. So I think with that, I just want to say thank you for this opportunity to join you all, and have a great day.
Thank you, Dr. Bell, for your work in raising awareness for all and building services for justice-involved people. Truly shows your passion and commitment. Our next speaker, Dr. Scott Abrams, is the Medical Director for CentraCare's Coordinated and Correctional Medicine Program, which provides medical care for those incarcerated in 3 local county jails, and which coordinates follow-up care for those patients in CentraCare's Coordinated Care Clinic. Due to his own personal experience with opiate addiction, his career has led him into addiction medicine for the last 10 years, and more recently into correctional medicine. Board certified in family medicine and addiction medicine, he is passionate about helping the addicted, incarcerated, and underserved find recovery and healthy living. In his current role in correctional medicine, he's written CentraCare's policy on medication-assisted treatment in jail, with which directs care for patients while they're in jail and after they're released. Dr. Abrams, we're so excited to hear from you and learn more about your work.
Hi, I'm Dr. Scott Abrams. I work for Centricare out of Wilmar, Minnesota, and St. Cloud, Minnesota. I work in addiction medicine, and the way I got to addiction medicine is really through my own experience with addiction. I met opioids back in medical school. I had a surgery, like a lot of people, had a surgery and got hydrocodone or Vicodin for the first time, and realized that I was in love with that feeling. I'd never had opioids before, and realized that that was something that I very much wanted more of. Didn't realize at that time that I had any potential for addiction in me, but that was the beginning, really, of a long downward spiral. And so that was my last year of medical school, and as I went into residency and then into practice, I began having more and more access, and that was kind of the beginning of this 15-year downward spiral of opioid addiction, and culminated about 10 years ago in 2014 with me losing my job, having to go before the state medical board. My family is a disaster, and so this was a real life disaster for me. This was it's where addiction takes a person. We give up everything for the drug eventually. And so through that experience, through finding recovery, I really turned to the 12 steps and AA, NA. I returned to my faith and found an authentic recovery, and really radically changed my life. And of course, that's drove me to use my medical license, my medical skills to try to help others who struggled as I have. That's taken me into correctional medicine, so I spent a fair amount of time in jail, and it's taken me to addiction medicine, so I spend a fair amount of time in the clinic working with those who are addicted. My own experience, of course, is that of abstinence. I've been abstinent from mood altering chemicals for 10 years, and that's what uh, that's one of my goals with, I think, all of my patients, really. And but in learning addiction medicine, I've had to learn that not everybody is there yet, right? And so ran into this idea of harm reduction, and harm reduction, I think, is sometimes set up in opposition to or opposed to abstinence, but I think it's really a continuum. I think we meet people where they're at, and we try to help them improve, and we shoot for progress and not perfection. And so harm reduction is really just trying to decrease the impact of the disease on people, and we can be working for or towards abstinence at the same time. So where I'm going with this is when it comes to things like Narcan, uh, or fentanyl test strips, those kinds of concepts that fall under harm reduction philosophy. These are things that are inherently somewhat in contradiction to the absence background that I came from. So the concern, of course, is that I run into all the time. And this is really the point of where I'm going, is that we're working on changing culture, right? So that what I run into all the time is that this idea of, well, if we're providing Narcan to patients, aren't we just encouraging them or allowing them to continue their drug use? Aren't we going to encourage more drug use? So now we're on the side not of stopping drug use, but encouraging drug use. And that's, of course, studies have not shown this to be true. Of course, studies show that providing Narcan decreases opioid overdose deaths and does not increase drug use. And so I've had to embrace things that are not necessarily obvious to me and my abstinence-based background, but to meet people where they're at, to try to save lives, to try to improve health, to try to decrease the impact of disease while working towards recovery with those patients. And so, for instance, one place where we are working on that in Centricare is working with our medication-assisted treatment policy for our jails. We have the contract with 3 large county jails, and are rolling out this idea of giving Narcan to those inmates that have struggled with opioid use disorder. Well, this bumps into that culture of, we're just now encouraging drug use. And so that's the challenge, is just to continually work on education, reminding people that this information is out there. The studies have been done. Narcan does not increase drug use; it just saves lives. And it needs to be something, though it may be counterintuitive to our goals, where we think it may be counterintuitive to our goals, it's actually in alignment with our goals. We're helping people decrease the impact of their disease in their lives. And so that's just, it's sometimes an uphill battle in certain places, but it's a cultural shift that we're working towards. And that's what it takes, is just time and effort and continually working at it. So in this context, we are working towards and promoting Narcan use for our opioid use disorder patients to the end that we will decrease the impact of the disease, that will save lives. And so that is a short explanation of why I'm doing and what I'm doing, what I do. And so thanks for listening, and thanks for being involved. Thanks for your interest, and do what you can to get out there and get involved in Narcan distribution and opioid overdose prevention. Thanks for your time.
Thank you, Dr. Abrams. It's so inspiring to hear your story and see you draw from challenges to bring hope, understanding, and real services to so many people. Our next speaker, Shane Hollow, has served as a union president for the Hennepin County Association of Paramedics and EMTs since 2021. Shane has been working as a full-time 911 paramedic in Hennepin County since 2013. The Hennepin County Association of Paramedics and EMTs represents the paramedics, emergency medical dispatchers, and emergency medical technicians of Hennepin County EMS. Shane is here today to share his unique frontline perspective on the opioid epidemic and the impact he has seen on communities every day. Shane, thank you so much for joining us.
My name is Shane. I'm a paramedic in Hennepin County, Minnesota. I've had the privilege of representing 200 other paramedics and EMTs who work in Hennepin County and perform really meaningful and life-saving work every day. I also have the privilege of performing that work alongside them. My experience with naloxone and the opioid epidemic over the last 11 years is somewhat intimate, and I think different from what others would experience every day. I mean, we respond to overdoses on a daily basis, and we've seen the direct impact of positive outcomes and negative outcomes. And I think, our profession and public safety in general has seen a increase in availability of resources for opioid overdoses and for resources for families, et cetera. When I started as a paramedic 11 years ago, those resources were really not available. Narcan was something that we did give, and we gave often, but it wasn't something that people necessarily put a lot of effort into the cause of why and how that medication is impacting the public. So over that time period, I've seen the increase of availability of resources and harm reduction resources for the community as well as for the ambulance services. And I think we've seen a decrease in destigmatization of the use of harm reduction tools such as Narcan, such as Naloxone, leave behind kids, fentanyl test strips, the availability of resources for our patients in the emergency department, also on the ambulance, and then the recent addition of Suboxone availability for our patients post-overdose, those are experiencing withdrawal symptoms. I think in Minnesota, we're, in terms of pre-hospital care, we're leading the nation in addressing the opioid epidemic and increasing the availability of those resources to our patients and the public. The reach of opioid overdoses is prevalent across our service area and impacts every community that we touch on and that we serve, which really drives home the point that it's incumbent on the public to carry naloxone, get trained in naloxone, seek out those resources so that if you are in a situation where you're around someone experiencing an overdose, you can act quickly and be able to help that person prior to the arrival of emergency medical services. And, you know, I think having that resource available can really and truly save somebody who's in need, who may need that medication immediately versus within a few minutes when first responders can arrive. I just want to thank everybody for the opportunity to be a part of this webinar.
Thank you, Shane. We appreciate the work you do and all of the challenges you overcome to save lives in the community. You're a true hero and are grateful you could join us here today. Next, we'll be turning to Marty Paulson, who is the Executive Director and CEO of Project Turnabout Addiction Recovery Centers. Since joining the organization in 2005, she has held many roles, including Chief Operating Officer, Senior Director of External Relations, and Director of Healthcare and Intake Services. Marty is a founding member and current president of the Minnesota Alliance of Rural Addiction Treatment Programs, where she works with other rural treatment providers to advocate for legislative policy related to rural healthcare and addiction. Marty sits on the board of directors for the Minnesota Rural Health Association, as well as the Minnesota Alliance on Problem Gambling Board. She holds a Bachelor of Science degree in Business Management and a Master of Science in Business and Organizational Performance. Marty is also a registered nurse and one of the very few nurses in Minnesota who are internationally certified as an addictions registered nurse. Over Marty's 30-plus year career, she has worked in several nursing and leadership capacities. Marty has presented at multiple state and national conferences on problem gambling, chemical addiction, and rural healthcare issues. Here now is Marty.
Hi, my name is Marty Paulson, and I am fortunate enough to be the CEO of Project Turnabout Addiction Recovery Centers with our main campus in Granite Falls. Project Turnabout is going on its 45th year of action against drugs, alcohol, and we specialize in one of 5 facilities in the nation on gambling. And so we're very proud of that. We have what's called a very full continuum of care. And what that means is we start out with our own prevention services, and we move on to DWI classes and offender classes. We go to outpatient and intensive outpatient services, residential services for men and women on high, medium, and low intensity levels. And that just means that we take the very sickest and help them to get to a place where they don't need very many hours of treatment services anymore, but we're just helping them in structure and living skills kinds of things. And so we're very fortunate to have that. We have a full withdrawal management program, and we call it 3.7, 3.2, and regular detox. And so we are providing the highest acuity level that you can get in detox in outer states or outer counties of Minnesota. And so we're really happy about that. And that has been about in the last 3 years. We are also lucky enough to have a sober living home for men and a sober living home for women. And those are both in Willmar, Minnesota, along with our newest campus in Willmar, which is only women. And we have a very unique program there where we bought 5 townhomes, and each townhome holds 2 to 3 women, and they can live there for free as long as they are furthering their education. And by that, I mean getting their GED all the way through any level of college whatsoever. As long as they're in school, they can live there for free. We are attempting to really give as many resources as we possibly can, and from detox services all the way through to recovery and post-recovery into life itself. And research has shown time and time again that with those services, people's recovery becomes stronger and stronger every day. And so we're really proud of those things. And we're always looking to meet our mission every single day. And our mission is very simple. And that is to keep our doors open to as many people asking for help as possible. Right now, our latest search is for where do we place more withdrawal management services. The state of Minnesota is really short on beds, and rural Minnesota is even worse. We are looking towards adding some withdrawal management beds so that we can better serve those in need of those types of services. And so we're proud of that. We are working with many different things. In the last 3 to 5 years, treatment has changed extensively. And that is, with the addition of almost every drug standing the chance of having fentanyl in it, and nobody knows about that, all the way through to, much stronger and heavier methamphetamine with fentanyl in it. Therefore, we're seeing more drug-induced psychosis, more need for mental health services at the same time as detox services and treatment services in and of itself. And so we're needing to shift a bit. We're needing to shift in order to meet the patient's need with the drugs that we're seeing today. Unfortunately, we're starting to see more and more xylazine, which is actually a horse tranquilizer. Very, very dangerous drug. And there are no Narcans for xylazine, which makes it even scarier. I know that we're doing a lot of learning on Narcan today. And I think the biggest message I'd like to get out there is to be aware of the fact that Narcan does not hurt anyone. If you give somebody Narcan because they're unresponsive and it doesn't do anything, and there's another problem, you did not hurt that person. And so learn as much as you can about Narcan, about how to dispense Narcan, because during those tense times, all the education you can get prior to that will be helpful. And it will help you to stay calm and to know that you're not going to hurt that person. You're only going to help them. And that's really an important thing to know. And the other thing is, I would ask that anybody involved in this webinar, gets that message out to as many people as possible. I am all about rural Minnesota. We want to hit as many people as we possibly can to have the knowledge that it takes to keep as many people alive as we can. Rural Minnesota is not exempt, nor is anyone. And so I thank you for listening today and for being a part of this absolutely wonderful webinar. Thank you.
Thank you, Marty, for all the work that you do. It is so great to know that our neighbors can get the treatment and recovery resources that are right for them during their most challenging transitions right here in Minnesota. Next, we're excited to turn it over to Sheila Watercott, the current chair of the Minnesota Prevention Alliance. Sheila is a community health educator in Little Falls Community Schools in Minnesota and serves as a youth substance use prevention coordinator in Little Falls. She has over 15 years experience coordinating community projects focused on health and safety. As a project coordinator in Little Falls and Morrison County, she has successfully helped the community achieve outcomes in reducing youth substance use, spreading awareness of effective substance use prevention strategies, and educating the community on the harms of marijuana, alcohol, commercial tobacco, and prescription drugs for youth. In her community health roles, she has collaborated with several partners across multiple community sectors to achieve positive health outcomes among youth and families. Several of her top career accomplishments have been contributing to the success of grant writing and all aspects of grant project coordination, including the Drug-Free Communities grants, the Positive Community Norms grants, and the Sober Truth on Preventing Underage Drinking Act, also known as the STOP Act grant. Sheila, thank you for joining us and for all you did to help bring us together today.
So an important part of substance use prevention is a look at primary prevention. And so the coalitions that exist in Minnesota, and of course, Minnesota Prevention Alliance, which is a coalition across Minnesota. So the coalitions exist to bring forward a set of strategies aimed to prevent harmful behaviors that lead to substance use and addiction. From the MPA perspective, with our focus being youth substance use prevention, those strategies include education for youth and parents, policy strategies that help limit youth access to substances, enforcement strategies that help limit youth access to substances, support strategies to ensure families and youth do not have barriers to accessing substance use treatment, services, support services, and recovery services. Substance use prevention coalitions have been established in many communities across Minnesota through support and grant funding from DHS Chemical Health Division, MDH, SAMHSA, and CDC. Coalitions formed by community members working together can effectively implement both individual and environmental strategies at the community level. MPA was established to work together to promote and enhance substance abuse prevention across the state of Minnesota. MPA is represented by community coalitions and other organizations supporting substance abuse prevention in the state of Minnesota. MPA is currently funded through the Drug-Free Communities Grant with the CDC. Some examples of youth substance use prevention strategies have included substance use prevention curriculum in schools, implementation of social host ordinances in communities, prescription drug take-back practices in communities, substance use prevention education for youth, parents, and community members, responsible beverage server practices, place of last drink practices in communities, compliance checks practices, youth leadership development for advocacy. So working with the Minnesota Prevention Alliance, it's a unique role to connect many resources across Minnesota that are working on these strategies. And so strength comes in those numbers that we build, connecting community to community, youth to youth across Minnesota. The most effective primary prevention is to help our young kids and our teens not even go down that path of substance use. And so education like this webinar is so helpful for community members, for families, for youth to understand what it means to effectively prevent substance use with our youth and prevent any of the dangers that can come with use and addiction long into adulthood. Minnesota Prevention Alliance and many substance use prevention coalitions across the state of Minnesota exist to help support our youth and families in our communities. Any role that you have in the community makes you a great candidate to be a volunteer or a member of a coalition, whether it's the Minnesota Prevention Alliance or a coalition in your community. If there's a coalition in your community that exists already, please reach out to them and learn more about the work that they are doing there. If you're interested in the Minnesota Prevention Alliance, please reach out to us. Our contact is included in this webinar, and we're happy to include any members across the state of Minnesota to join our coalition. If there is not a coalition in your community, please talk with your public health departments, your law enforcement, your health care, and other parents and school officials that want to work towards creating a healthy environment for our kids. And coalitions really do come out of the community. And so please reach out to any of the resources in this webinar. To be part of a coalition, all it takes is somebody who really cares about their community, really cares about our kids, and really cares about making our communities a healthier place for everyone.
Thank you, Sheila. It's always such a pleasure to work with you. Today is such a great example of how you truly bring the entire community together to make a difference. Our final guest speaker tonight is Colleen Roney, the founder and executive director of Change the Outcome, a nonprofit she founded after losing her 20-year-old son to an opiate overdose in 2016. She has been a steadfast advocate on multiple fronts related to the opioid epidemic. Her efforts include collaboration with a wide array of coalitions, advocates, educators, and legislatures to make meaningful progress to address this public health crisis. Her successful legislative efforts to require all schools in Minnesota to maintain Naloxone has saved several lives. This dangerous lack of education and overwhelming stigma facing young Minnesotans who have been or will be impacted by the opioid epidemic led her to her highly personal mission of developing and delivering relevant and honest education programs to reduce addiction, prevent overdoses, and save lives. Along with the team of young adults in recovery, Change the Outcome has presented to more than 90,000 students and educators across the state. Colleen, we're excited to hear from you.
Hi, my name is Colleen Ronnie, and I'm the Executive Director of Change the Outcome. Change the Outcome has been around since 2017, and the goal of our organization is to bring really relatable, impactful education to young adults throughout the state of Minnesota. I started this work because I was frustrated at the lack of information that was being provided to young people, specifically to my boys and the parents who unwittingly some time ago maybe got swept away in some of the prescribing practices. I lost my son, Luke, to an overdose in 2016, and he was just 20 years old. His addiction started with prescriptions after oral surgery and a resulting infection. So since then, I have been working with a group of young people in recovery, and we have traveled throughout the state of Minnesota and gone into middle schools and high schools. We've presented to almost 90,000 students. And I think one of the biggest challenges really nationally is this lack of education that's being brought to young people about the opioid epidemic, fentanyl, the leading cause of death for young people, which is overdose. And I had someone recently ask me, why would young people put themselves in that danger? Why would they be making choices that are so risky, by taking a pill or something like that, that might result in an overdose? And I think we are so unaware of how unaware most of the general public is about substance use, and specifically opioids, and wonderful tools like naloxone that can reverse an overdose. The Pediatric Journal of the American Medical Association just published an article a few weeks ago about the lack of knowledge that young people have surrounding naloxone and overdose. And it was astounding to me that only 30% of young people know what naloxone is, and only 15% know how to administer it. We can treat people forever. We can reverse overdoses forever. But if we don't stop the flow of those things happening, the problem's never going to go away. So empowering young people with knowledge and tools like naloxone, that they can so easily use. Policy is a really big thing too, I think. We initiated some legislation here in Minnesota that required all schools in the state of Minnesota to have naloxone in their buildings, and then trained personnel who know how to administer it. And it has saved lives in our state. And when we can share that with other states, when we can share the things that we're doing in one location and other areas can build on that, it really can have a very tremendous impact on how we're approaching prevention of death, prevention of use. I think that we can do a better job always, but we're getting there. And I think that young people in particular, 95 of the 90,000 students we've presented to have said that they believe that other people their age would benefit from education. And 98% say that our education is impacting or will impact their future decisions about their substance use. We cannot lecture young people. We cannot continue to say, just don't do this or don't do that. We need to give them some awareness and understanding so they know why they need to make certain decisions or what decisions will benefit them the most. So I really think that education is kind of where it's at. We can do so much more with that. And for every young person we educate, they go home, they tell a friend when they're on the bus going home, or they tell their parents or siblings. And it really has a very large rolling impact that can change the way this public health crisis continues to roll out. I would encourage anybody who has a network, somebody who they know who works in a school, to invite us. Unfortunately, Change the Outcome is funded through state grants, through the Opioid Epidemic Response Advisory Council. And so there's no cost to any school or any community for us to bring our program to your community or to your school building, to your students. This is not rocket science. I mean, we do not have to have this great wealth of influence or ability to truly understand all the scientific mechanisms that go into mental health or substance use disorder. And we can take some really good basic information and deliver it and have a big impact. So I hope that you'll invite Change the Outcome to your community. We have, again, it's a 4-part program. We survey students before we go into a school. They watch a short documentary that fits into a class hour. A team of young people in recovery who are under the age of, are very close in age to high school or middle school students, speak to students, to share their stories, share what they learn, and weave in the tools to their personal stories. And then we survey students after we leave so we can provide a report to the school to say, this is what students knew before we came in, this is what they know now. And yeah, it's really been a very fulfilling effort, and I'm glad to see it growing. So thank you very much for the opportunity to participate in today's webinar.
Thank you, Colleen. We know that your work has helped reach so many youth with the messages they need to hear and help give a voice to youth who are being personally affected by the sad state of opiates now. For our audience today, we are excited to announce that Colleen has also shared with us a trailer for her new Change the Outcome film. Please stay back just a few minutes after our webinar concludes today, and you can hear directly from young leaders working with Change the Outcome and get an introduction to their amazing stories. Thank you again to each of our speakers today. They are doing so much to raise awareness and expand services in this challenging environment. And now we will view the overdose prevention simulation portion of this event. Walmart has invested in virtual reality equipped training for their associates to build skills in unique situations that are hard to replicate in a classroom setting, like front of store shopping experiences and emergency preparedness simulations. This technology led to the development of non-retail training such as the VR, which we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay. Jay. Wake up, man. Wake up or I'm calling the cops. John. Hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting Naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We are so excited to work with you to connect this resource with community members. We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. We also want to thank our friends at CADCA, and you will be seeing some contact information for their team on screen in just a moment. Please take a moment to learn more about their work in building safe and healthy drug-free communities. And finally, thank you so much to all of our coalition members and supporters of the Minnesota Prevention Alliance. We look forward to staying in touch with you. So if you would like to become more involved, check out our website at minnesotapreventionalliance.org or send me a text at 320-733-2376. We hope you'll stay tuned to see the trailer for Change the Outcome. This concludes our webinar. I wish you have a great rest of your week.
We're losing a generation to this disease. And it's hard to even begin to understand or wrap your head around the numbers of people who are being impacted by this.
Addiction doesn't discriminate. It doesn't care how old you are, what gender you are, what race you are.
Addiction erodes or destroys relationships. You start losing your connections to your family, to your friends.
I felt lost, like I didn't belong, that there was no hope for me, that there wasn't going to be a brighter day.
I was not okay. I was not myself. It just destroyed my body, and it just gave me a reality check. I really don't know what's in what I'm using, and I could have really ended it.
Fentanyl has just wound up in pretty much everything that people are consuming.
Pressed pills, they look exactly the same, and you have no clue what is inside it.
It can just take one to have a fatal impact. It's very serious. It's deadly.
People feel like they need to deal with it alone because of the shame. If you're using drugs, you're a bad person, you're a degenerate, No, people who are using substances are sick and they need help and they need compassion.
One of the worst parts about addiction is how isolated it makes people feel. You think that you're alone, that you're unlovable, that you're a burden to people, and it's not the truth. You're not alone.
You know, it can be the hardest thing in the world to ask for help. But that's the only hope, is to ask for help.
We need community. That's where the hope comes. And in my mind, community is where grace actually exists.
One of the most effective treatments for addiction and for substance use disorder is to join people, is to connect with people, to know that you're not alone.
Connection is the opposite of addiction.
People love you. People care about you. They want to be with you. They want to help you.
There's a lot of people out there in recovery. You can't tell them apart from anyone else, and so you don't realize how much hope there is for people with addiction.
The hope is with young people, because they are the ones who can shut this thing down. They are the ones who can keep this problem from growing.